This conference will now be recorded.
Welcome, everyone. This is Caitlin Emmerich from Linn County Public Health, and welcome to our virtual town hall for today, where we're going to be talking about information for businesses during the COVID-19 pandemic. We're joined by several individuals from our community that have information or stories to tell about how businesses can receive additional information and have guidance during this time. We have 4 speakers today. Jasmine Almoyed, and I'm sorry, Jasmine, you'll have to fix my pronunciation, from the city of Cedar Rapids. Heather Metter from Linn County Public Health, Dustin Hendricks from Linn County Public Health, and Lacey Hogan from Alliant Energy. And I am going to ask our speakers to briefly introduce themselves, and we are going to have Lacey introduce herself last and give an overview of what Alliant Energy has done related to responding to the COVID-19 pandemic, as I think that this will generate some questions for our participants. So Jasmine, could we start with you, and could you introduce yourself to our participants today?
Absolutely. I'm Jasmine Almoyed. I am the Economic Development Manager for the City of Cedar Rapids.
And Jasmine, can you talk about your role in terms of the COVID-19 response and the business recovery team?
Yeah, absolutely. So we work with a larger team of individuals who provide economic development resources and services to businesses in the Linn County area. And so we have been working with a group that includes individuals from the Metro Economic Alliance, Medco, the EDC, the SBA, the Development Center, and a number of others, on making sure that as resources are becoming available either through the federal government, through the Iowa Workforce Development Office, state resources that might be available, on how we are getting to the business community and making sure that those resources are taken advantage of locally. We're also providing services just in terms of making sure that as businesses have one-off questions that we can connect that and try to get information. We've worked with a group of individuals on creating a resource page, thegazette.com/coronavirus, for both businesses and residents. So at this time, really what we're trying to do is make sure that we're staying in close contact with both small businesses, our larger employers, and each other, to make sure that, as these businesses are struggling to, continue to thrive in a very uncertain economy and in a disaster that's unlike anything we've seen before, that we're staying in contact to make sure that we can plug in where necessary. And if there are specific types of issues that are coming up, we're making sure to get that information to the policymakers to consider as we continue down the path of this pandemic, in terms of, what will things start to look like in the future, and making sure that those considerations are being planned for in a thoughtful way.
Thank you, Jasmine. Heather, could I ask you to introduce yourself next?
Yes, I am Heather Metter. I am the clinical branch supervisor for Linn County Public Health. I am also operating as the operations section chief for the COVID-19 pandemic. For the pandemic response, I am working with various groups. I work with Jasmine to help disseminate information for our business community. We also have work branches for mental health response, obviously our disease follow-up with this response. I work with the hospitals, clinics, long-term care facilities, our EMS groups, and community information. So my role is just to help get right information to the right people so that you can make the best decisions possible as we navigate together through this response. Thank you.
Thank you, Heather. Dustin, could you introduce yourself, please?
Sure, this is Dustin Hendricks. I'm typically the Food and Aquatic Safety Supervisor here at Linn County Public Health. During COVID-19 response, I'm involved with the Incident Command System, working on community information with Heather's group to try to ensure that we're providing information to everyone that we can within our community who most needs it.
Thank you, Dustin. And then our final speaker for today, and person who's going to help answer some questions, is Lacey Hogan with Alliant Energy. And Lacey, I'm going to ask you to introduce yourself and then share a little bit about some of the best practices that Alliant has implemented in terms of COVID-19 response.
Thank you, Caitlin. Good afternoon, everybody. Thank you for allowing us this opportunity to kind of provide on what we're doing. At Alliant Energy, even during a COVID-19 situation or just our day-to-day operations, our number one priority is the safety of our employees and our customers. So as we started getting into this situation, we acted early so we could continue to uphold this core value that's really important to our company. Some things we did prior to this was we were working towards moving to a more digital workforce, allowing our employees to work on job sites, not having to be at their desk in the office all the time. So when we did make the transition to work from home, given the situation, it was a lot smoother and easier for us to transition. Some of the steps we have taken, are limiting access to our facilities. So at our op sites, we're having job sites report. So that means our workers and things don't have to come to a facility. They can just report to that job site and begin their work. We also implemented, for those who do need to still come in our facility, some social physical distancing, disinfecting, cleaning areas, and other safety procedures. The one thing we are continuing to do is to communicate with our employees, our customers, just to keep them advised on what we are doing, the steps we are taking, answer questions as they come up, and keeping them informed. We're also planning for our next first. So we understand, as everybody knows, the situation is changing and it continues to change day by day and over time. So we look at what could happen so we are prepared for those next steps, and we're more of an active approach instead of a reactive approach. The other thing that we're doing that's really helping us is we're tracking all of our activities that we are doing. So this will be used in a twofold. We'll use it for our lessons learned in our after action report after the situation is over, and we go back to a new normal working environment, and it'll allow us to be better prepared for the next situation. And then we continue to use it as we transition back. So as we change things because of this situation, some of those things we'll need to look at as we go back and make those adjustments back to what they were.
Very good. Thank you, Lacey. Oh, I'm sorry.
Well, I was going to introduce myself. So I work with our emergency management department, and I'm also a member of our crisis management team at Alliant Energy. I'm based in Cedar Rapids, and we cover territory for both Iowa and Wisconsin. So I apologize to do that first.
No problem. Thank you for all of our speakers or panelists for being on the call. For those of you that are on the line that have questions for them, I'm going to just outline what our format is like. So we have an opportunity for people to submit questions in advance. So we're going to first answer those questions that were identified ahead of time, and then we're going to open it up to people that have questions now live. If you do have a question right now that you would like to submit, you can use the chat function within GoToMeeting to submit your question, or you could also email it to lcph.meetings@linncounty.org, and then we'll get to your question as soon as possible. And as I announced prior to recording this virtual town hall, we are recording the questions and answers and discussion today to be able to post and share publicly with people that are not able to join us. Sorry about that. So we're going to go ahead and start with the questions that were identified in advance. And as a reminder, if you have a question, go ahead and submit it to the chat function in GoToMeeting, or email it to the lcph.meetings@linncounty.org. So the first question is, if a local business owner has questions or needs assistance, where's the best place for them to contact? Jasmine, would you like to answer this question?
Sure. So there's obviously going to be different types of questions that come up depending on the industry type. So a small business owner and a large manufacturer are going to have very different types of questions going into this pandemic. So right now what we've done is We have, as I kind of mentioned earlier in my introduction, there is a resource page on the Gazette, thegazette.com/coronavirus. There's a business tab and there's a resident tab. And what we are doing with that page is essentially assembling a document center that has active links to all of the resources that are available. So there's information there from everything on, the Bartenders Guild has a specific grant program for bartenders to, information on the Paycheck Protection Program, Iowa Workforce Development. There's information back to CDC guidelines for businesses. So really what we're trying to do is direct people to that page if they need resources. If an individual needs greater assistance than that. So we've had, instances where small businesses aren't sure of how to apply for the programs, or maybe there is some other barrier, a local business owner who had a language barrier. They can reach out to really any of the economic development groups, and we'll funnel to each other. So if someone wanted to reach out to the city, even, we do have an EDS, Economic Development Services email address that I believe we have in some of the slides that we could share. As the starting point. You could reach out to the Economic Alliance or, the Entrepreneurial Development Center, any of those organizations, and we'll make sure that you get directed to the right person. There are people in the community, like the Small Business Development Center and SCORE, who are walking individuals through not only those application processes, but they're also, sitting down with these companies and really walking through their financials, their business plans, trying to help them make adjustments in how they can survive throughout this. We've had large businesses reach out because they need direction from the state of Iowa on, what they need to be doing inside their plants in order to be compliant or to try to keep their employees safe, or how do they access tests. So really, if you can't find the information on the websites really that are kind of what I would say the document centers for both of these would be either the Gazette website or the state of Iowa's website, which is the businessrecoveryiowa.com from the Iowa Economic Development Authority's website. We're all here to help. We're all here to provide assistance. So, people are more than welcome to reach out to us, and we're trying to get back to those emails within, an hour if we can. So we would encourage anyone who has questions to reach out.
Thank you, Jasmine. And I would just like to share with our participants that the resources that you are sharing are going to be listed in a slide at the end of our presentation and discussion here. We'll also share it out through the Linn County Public Health website. So for those of you that are scrambling to write these things down, we'll have them in a slide later and then also share them out publicly through our website. We are getting a couple of questions come in, but Jasmine, I want to move to the next question because it's related to the first one in terms of what is the status of available federal funding and how could this funding benefit businesses in our community?
Sure. So I think probably most people have heard the terms PPP and EIDL at this point. The Paycheck Protection Program and the Economic Injury Disaster Loan funding through the Small Business Administration are kind of what have been the primary federal source of funds at this point for small business assistance. The program was launched a couple of weeks ago where they received the first round of federal funding, and almost immediately those funds dried up. So if you've been following the news, on Tuesday it was passed by the Senate, and just I believe yesterday afternoon it was when Congress took action. The president is supposed to sign off on that today at noon, from what I understand. So hopefully as we speak, and more money will be placed into those funds. So the Paycheck Protection Program is actually administered through the banks, and the purpose of that program is to provide businesses who are keeping their employees on with a possible forgivable loan. You have to meet certain requirements by June 30th in terms of keeping staff on. But if you can apply for these loan dollars essentially to pay your employees and to pay, certain operational expenses, eligible expenses. And then as long as you can keep those employment numbers up through an 8-week period, then that loan will be forgiven and become a grant program. The federal government put an additional $310 billion into that program through this most recent act. They also are including an additional $60 million to be put into that economic injury and disaster, $60 billion into the economic injury and disaster loan program through the SBA. And $50 million of that will be set aside for the actual loans, and there's 10 billion that will be set aside for a grant component, so individual businesses can sign up for $10,000 grants through that program. That money, I don't know exactly when we can expect to see the grant programs reopen. I know that there was a number of individuals who applied but didn't receive the funds, or they went through the process and didn't get confirmation, so they may need to go back and reapply. On the Paycheck Protection Program, since that's being handled through banks, we would encourage you to reach out to your lender. On the SBA program, if you are having troubles with the site, we do have a local SBA office. And again, we have SCORE chapter here that's very active that can also assist with that. So as for the funding, we know that it's going to be available, which is great. There's also been some provisions that have been added this time around regarding publicly traded companies. So that way there is, no more Steak and Shake or whoever it was, or Shake Shack, taking that money before it can actually get to the small businesses as it was intended to do. There's also going to be another provision where a certain percentage, I believe it's 60 billion of that money for the PPP program, will be given to smaller lenders because of some of the things they learned out of the first round of funding. That said, I think the money will go quickly. And so I would encourage businesses who haven't taken a look at whether or not that might be a good option for them to go to those sites, read through the programs to get specifics. And if you need more help with that, we do have individuals in the community that we can connect you with that can assist.
Thank you, Jasmine. We have another question that came in that is possibly linked to our question number 3 here. So I'm going to go ahead and read that question. It says, we are deemed an essential business and some of our employees need to report to the workspace. Do you have a trigger point as to when we should require screening employees before they enter the workplace? Heather or possibly Dustin, would you like to answer this question?
Sure, this is Heather, and I'm happy to answer that question. At Linn County Public Health and the Iowa Department of Public Health, what we are recommending for screening is that all employees should be screened prior to entry into the workplace. So before starting work, it's before they enter the actual building or that workspace, that they have been screened for fever. They've also been screened for any type of respiratory symptoms such as runny nose, cough, sore throat, anything that shows that they may not be feeling well that day. Any employee that demonstrates symptoms of illness should remain home until they have been free of a fever for a full 3 days without the use of medication, that they've had symptom improvement, and that it's been 7 days from the onset of symptoms. So all 3 of those metrics should be met. We know that can be very difficult for employers as you're trying to keep your staff volume up, but at the same time, using that prevention step could help to reduce the burden of disease or infection within your workplace. Other things, I'm looking at question number 3 there too, other things that businesses can do to help prevent infection within their companies or facilities is really working to encourage flexible work from home schedules, if that's possible. Also looking at leave policies. And when we talk about leave policies, what we're saying is we want you to take away any incentives that might be there for perfect attendance. We really want individuals that are ill to stay home and not come to work. So if they feel that they're going to be penalized at all for not being there, we may have people coming to work that shouldn't be there. So really looking at those leave policies and really enforcing to your employees that every employee matters and that we are all in this together. And if you are sick, please stay home, because if you bring something in to that office space, to that workspace, to that facility, potentially dozens of people could be exposed, and that would have an even larger impact to your workplace. We also suggest considering staggering shifts to reduce the number of worker population at any given time. Look at your breaks that you offer employees and your lunch schedules. Make sure that those are staggered. Again, so you don't have large groups of employees that are all eating or taking a break at the same time. And consistently remind employees that social distancing, so that physical space between employees of being 6 feet or more, should be maintained at all times. And that's just not while they're working, but that's also if they're having lunch, that they're maintaining that physical distance of 6 feet or more while having lunch, while taking a break. If they're going outside, public health will never recommend smoking breaks, but if they're taking a smoking break, that they're keeping that 6 feet of distance between themselves and others. So again, with that 6 feet of space between people, look at your workflow areas, look at that spatial distancing within your facilities. What can you do to help maintain that distance between people? We would also encourage businesses to allow employees to wear their own homemade cloth face mask. And again, the use of those face masks is not to protect somebody else from becoming sick or from getting sick. What that face mask does is to help prevent someone that may be sick from spreading it to others. So if I'm wearing a face mask, that face mask that I am wearing is not going to protect me from getting sick from somebody else, but this face mask that I'm wearing is going to protect you from getting sick from me if I am ill. We also want to encourage businesses to provide hand sanitizer and hand washing opportunities as much as possible. Again, we always want to talk about those 3 C's of covering coughs and sneezes, containing yourself at home, but also cleaning your hands as much as possible. Soap and water is always best. We know that you may not always be able to get to the soap and water, so if you can't, that's when we recommend the hand sanitizer. So those are the tips that I have. I don't know, Dustin, if you have anything else that you wanted to add to that list?
That was a pretty complete list. The only thing I would also note is that obviously every business is very different. We can't really provide a blanket set of guidelines that's going to fit every single business. So you kind of have to take a step back, look at your business flow of operation, look at your number of staff, look at how you can make adjustments, and be innovative in order to make adjustments to your business process in order to try to afford as much protection as you can for your employees as well as your customers as we get through this.
Thank you. I went ahead and advanced the slides to look at our next set of questions. In the meantime, we have received a couple of comments coming in, and I think that these are because we have a representative from Alliant on the line here. But one of our participants wants to point out that related to energy assistance, that Alliant Energy is giving an extension on paying their bill. Lacey, do you happen to can you confirm that for us, or?
Yeah, I would just say, each customer is different in case-by-case basis. So I would just encourage folks, if they do have questions, to contact our customer service and also go to our website. We do have a page that, go to alliantenergy.com/COVID-19. There's a whole page on situations that are dealing with bills and answer questions pertaining to the COVID situation.
Thank you, Lacey. A couple of comments in our chat box related to energy assistance as well with the LIHEAP program. So that certainly interacts with your business and is more for your customers than you as an employer, but we appreciate your response. I want to move through the next set of questions, and I think we have one in the queue that relates to the process for reopening businesses. But for question 4, could we advise our participants what to do if they see a business that's not complying with the governor's orders?
Hi, this is Dustin. I can try to field this one, and then anyone else who has any additional comments, please weigh in. From our standpoint, what we're advising folks to do, it really depends on the nature of what you're seeing. If you're an employee who feels that your employer is not following guidelines appropriately as they're being laid out by the governor here in Iowa, as well as the Iowa Department of Public Health, we would strongly encourage you to reach out to the Iowa OSHA folks. And I would just recommend you visit their website. Just type in Iowa OSHA on your web browser, and reach out to their complaint line. If it's that serious and you think that Iowa OSHA, the occupational safety and health folks here in Iowa, need to know about the conditions in your particular work situation. If it's specific to a restaurant, for example, here in Linn County, or a food service operation, you can reach out directly to us at Linn County Public Health, and we can see if we can address it over the phone or through our regulatory means. Otherwise, if we're getting resistance, we will reach out to local law enforcement to actually enforce the orders or enforce the governor's proclamation items. It has only come to that a few times here in the last month, but it has come to that on occasion. Otherwise, you can certainly reach out directly to the non-emergency line for whatever the local law enforcement agency is that represents you here in Linn County and where that particular business would be located. Beyond those two items, you can still bring that to our attention here at Linn County Public Health if you have specific things you're seeing and you're not seeing folks follow the guidance that's out there in our community. You can call us here at 892-6000 with specific questions, and we can try to field them. Ultimately, we may send you back to the office of the governor, though, as well, to make those inquiries, since we can't necessarily interpret everything that's coming out of the state office. But we certainly are, approaching it as a team and trying to come up with the most responsible answer that we can for folks, and trying to get everyone on the same page and following the same recommendations so that we can tackle this thing as a team. Anyone else have any suggestions for folks who are seeing violations of the orders?
Not hearing any. Thank you. The sound. I fix that real quick.
Please enter your password. Please enter your password.
Okay, I think we can go ahead with question
Thanks for calling.
number.
Goodbye.
I apologize for our technical assistance here. I think we can go ahead to question number 5. Dustin, I think this one might be best for you. Just clarifying the governor's orders for the restaurants. Are they allowed to have food pickup inside the restaurant, or is that only curbside?
Yeah, definitely. I can field this. So restaurants are certainly allowed to have people come in and pick up food. The guidance early on was essentially that we don't want people standing and waiting inside of restaurants while waiting on their food. So ideally, people could call ahead and place their orders either via phone or over a web application if the business happens to have one of those. And then they can just arrive and either have the order brought out to them curbside or go into the facility strictly to pick up whatever items it is that they ordered from the food service establishment and leave and take those items home or elsewhere, at least away from other people. We have had some difficulty with this particular approach of people walking into facilities, just because obviously if you're having folks come in, you've got to police how many people can be in there. Per the governor's orders, only up to 10 people could ever be in one environment at a time. So we're requiring folks to put down decals on the floor, similar to what you've seen at grocery stores and other facilities around the area, to make sure that the individuals that are in there waiting in line to make their orders are at least 6 feet apart, and there are no larger gatherings than 10 people within the establishment. There have been instances when restaurants are not following these rules, and we have certainly enforced them when that comes up. For the most part now, though, everyone we've been in touch with, we've gone over this again and again and again, and they're all pretty well aware of these different requirements, so they seem to be complying pretty well at this point. However, certainly if you're seeing that out in the community, please let us know. If you're seeing people congregate inside of restaurants or inside of bars, etc., you may have heard that bars are allowed to reopen and sell to-go drinks. So people aren't allowed to hang out in the bar, but they are allowed to order drinks to go and take them to leave. And we have had a couple instances where people are just sitting down and having their drinks in the bar, and that is not permitted. So please be our eyes and ears and let us know as you see that in the community. But I will say overall, people have been doing a pretty good job of following those requirements. The challenge is definitely going to be from a staffing standpoint, enforcing these rules and making sure that if you're going to allow people in your business, they do not congregate, they're not hanging out close to each other, everyone needs to be 6 feet apart, and there shouldn't be any more than 10 people in the whole establishment. And that would include employees as well as customers to make up that 10 number. I think that's all the comments I have right now on that, unless anyone else has any follow-up.
Thank you, Dustin. For our question number 6 about what will be the process for reopening businesses, we have a question in our chat queue that I think connects to this. The question is about our communication from the city or county perspective, being in communication with the governor regarding reopening businesses. So for this person, I don't know that we have someone on the line that necessarily can speak to that particular issue, but I think the response for what will be the process for reopening businesses may touch on some of what you're looking for. Does one of our panelists want to take this question about the process of reopening businesses?
This is Dustin again. I can take a stab at it, and then other folks, I don't know if you want to try to weigh in. I don't know if Alliant Energy, for example, if you guys have any sort of a plan in place already. As I mentioned earlier on one of my responses, there is no one-size-fits-all approach to doing this. So again, you need to be very familiar with your business, with all of the operations, the ins and outs of how things are going to function between your staff internally and also the external customer. So we need to obviously approach this very slowly and ensure that everything that we're doing, every step that we take, we're taking into account the idea that we do still have active community spread of COVID-19 in the area. Certainly, the economy needs to move. However, we can do that in a method that protects all of our population as best as possible. So, for the example of restaurants, we've been allowing them to operate on very specific terms, taking into account social distancing, separation, disinfection, and decontamination of spaces that are publicly available. Every business is going to have to look at the approach that restaurants and other businesses that have been open throughout this entire pandemic response, and try to essentially mimic a lot of those opportunities. So, anything that we can be doing to move business online or over the phone and keeping people out of our actual physical business space is very important. I think we're going to see a wide variety of industries that maybe haven't done this in the past have to make some adaptations to how they do business, and we're strongly encouraging that of facilities. Certainly also, as we start to allow more and more workers to come back into the environment, businesses need to be doing everything that they can to ensure that they're not bringing back folks that are symptomatic or that are carrying the COVID-19 virus. They need to be doing everything they can from a personal protection equipment standpoint. Just because we're opening businesses up again does not mean that COVID-19 is not actively spreading in the community. I'll reinforce that again. So every step that we take has to be done very judiciously, very cautiously, and keeping in mind that this thing is still active in our community. And we will get more guidance from the state on this, as well as from the federal government. And we'll approach this together. And as we have specific scenarios come up, we'll provide as much guidance as we can to ensure that we're all opening in as safe of a manner as possible and doing it as calmly and as organized as we can. Thanks.
Hey, Caitlin, this is Lacey. So what we're doing at Alliant Energy is we actually have a dedicated team that is looking at how we are going to come back. They're looking at how we did business before, how we're doing business now, and what changes can we make in the future. And again, that our safety is our number one for not just our employees, but our customers as well. So we are looking at what PPE do we need to have, what do we need to do to adjust to make sure everyone has what they need. And we follow the CDC guidelines, and we just continue to reinforce those with our employees, and we'll continue to those practices as we start phasing back in.
Thank you, Lacey and Dustin. I'm going to move to the next set of our questions, which deal more with the medical components and the spread of disease within the business. So this question number 7 is, am I considered exposed if a coworker has been identified as a contact to a positive case? Can I work if this situation occurs? Heather, would you be able to answer this question for us?
Sure, I'd be happy to take this question. So a lot of this is going to depend on the type of work that you do. So for businesses that do not have essential services, and so essential services would include things like healthcare providers, law enforcement, fire and EMS, long-term care personnel, residential support facilities. For those individuals, if you have a coworker that is ill and you are an essential service provider, we would take a look at what does that exposure look like. And if you were together within 6 feet of each other for 2 minutes or more, we would consider that a contact of significance, and we would ask that you self-isolate at home for 14 days. However, since you are an essential worker and you not being there may be a huge detriment onto the infrastructure of our safety as a community or our healthcare infrastructure, you would be allowed to work with certain caveats. Your temperature and symptoms would need to be checked before and after work. You would need to report immediately if you started to feel ill at all. Plus, for any patient interaction, you would need to be wearing a mask and eye protection. So there are some caveats for essential service personnel. However, for anyone else, there's some different things, again, that we're going to look at. So we've had questions like this come up before, and sometimes people are wondering, well, my coworker has COVID-19, am I considered exposed? And then when we do some more investigation, when we talk to them a little bit longer, we'll find out that your coworker may be positive for COVID-19, but you were actually never around them or worked separate shifts, and so we're not even on the same shift as that coworker. And no, that would not count then as an exposure. What we would do, though, if we found that you were within 6 feet of that individual for a significant amount of time, and what we're looking at for most industries, and again, it's going to depend a little bit on the industry, but for most, we're looking for about 30 minutes within 6 feet of each other. We would consider that an exposure, and we would ask for you then to stay home for the next 14 days from the last time you had contact with each other. And for those 14 days while you are self-isolating at home, we'd want you to monitor for any signs of fever or illness. If fever or illness would start, we'd want you to contact your healthcare provider so that they could determine if they thought this potentially could be COVID-19 and if you should be screened and tested for it at that time. So there's a little bit of difference depending on the type of worker classification and depending on if you were actually in contact with that person or not.
Thank you, Heather. Our next question is, if I have an employee that tests positive for COVID-19, how should I clean within my business?
This is Dustin. I'll take a try at this one too. So in general, this is kind of going to depend on the type of business, again, that you have. I tend to like to send people to the Centers for Disease Control, the CDC website, because they do have some really good information specific to environmental cleaning, and they break it down by sector. They start with, is this for a business or for a home environment, and then kind of break it down further from there. But the basic principles would be you need to identify where that individual spent most of their time or, would spend their average day when they were working. And in particular, you want to look at, the few days leading up to their last day that they were there. You need to identify those areas, and you need to do your best. CDC definitely recommends, if you can, to actually close off those areas for a period of at least like 4 hours, but they recommend up to 24 hours, where you would actually close off those portions of your facility and not allow anyone in there. And then you would also do the best that you can in order to increase the outdoor air, so the air exchange that's coming in from the outdoor environment, so that you're bringing in fresh air to try to supplant the air that's already in the room. Basically, you're just trying to air the space out. And then you want to give it as much time as you can, like I said, at least 4 hours, but up to 24 if you can let the area not be occupied for that amount of time. At the end of that time period, you'd want to go in and do a very thorough environmental cleaning of all the different surfaces within that space that could have been contacted. So in particular, any of the common touch surfaces like doorknobs, walls that people may have touched, any sort of surfaces that would fall basically between like your ankles and shoulders, anywhere that people can reach frequently. And you want to go through and you want to treat all those surfaces with some sort of an EPA recommended cleaner and disinfectant. So this is another important thing for people to consider. I hear a lot of people talking about disinfecting surfaces, and that is really only part of the process. You first need to clean a surface. So if you have any visible debris or residue on a surface or soil, that needs to be removed before you can effectively disinfect that surface. So if you're just spraying Lysol, for example, on a surface and it's covered with a bunch of material already, you're not actually disinfecting that surface. You're just kind of smearing around whatever's on the surface. So you need to actually clean whatever the surface would be and remove any potential contamination and then disinfect the surface. So once that thorough cleaning has been done, you could look at reopening the space after it's been closed down for 4 to 24 hours. And then you could safely have your employees enter that space again and reutilize it for your business operation. So hopefully I hit all the main points there, but definitely the CDC has some great guidance on this.
Thank you, Dustin. We're moving into the last 2 questions here that were submitted ahead of time, so I just want to make a final reminder for those of you that are participating that you can chat your question through the GoToMeeting chat or email it to lcph.meetings@linncounty.org. I do have one question in the queue here from our email related to question number 10. But before that one, let's get to question number 9, is can a business still operate after having positive cases? What are they required to do? We have one of our panelists that would like to take that question.
So this is Heather. So some of it's going to depend on the type of business that it is. What are they required to do? As far as the disease investigation process, we will be talking to that business regarding the employees that may have been in contact with an infected individual. We will be talking to them about who needs to be sent home, maybe for self-isolation for the next 14 days. We'll be talking to them to see, has anyone else shown any type of illness whatsoever? We might be working with them to get testing for individuals that have appeared ill or have been ill. Also, we will be talking to them about cleaning procedures, giving them a lot of the great guidance that Dustin had just lifted up. But it's really going to be almost case by case. Every different business is going to be different. With the way they operate, with the workforce that they have in place, with who their customer base is going to be. So we work very closely with multiple individuals at both the state and local level to help that business navigate through the process once someone has been identified. So as far as what they are required to do, required is kind of a tough word. It's usually recommendations. Required is probably, as far as the disease investigation process goes, there's nothing that they're required to do, but it's strongly recommended.
Thank you, Heather. And then our last question that was submitted prior to our virtual town hall is, are employers required to notify employees of positive cases within the workplace?
And this is Heather again. So employers are not required to notify employees, however, it is highly encouraged. And I think it's important to remember that part of our disease investigation process when it comes to contact tracing and following up with individuals that may have been around someone that tested positive, we will be reaching out to those employers if we deem that that person may have been infectious in the workplace at any time. So we would be reaching out to those employers and also following up with those employees. So it's very hard to keep something like this quiet. So we do encourage those employers to notify all staff, and that helps to really make sure that we don't have a rumor mill going around and having stories that may not be true starting up, which can happen sometimes. Now, there are certain there are other agencies that might have oversight over a business, and those agencies may have some different regulations in place for those. So if it's a business that is maybe has oversight by the Department of Inspections and Appeals or through the Department of Human Services, they may have some different regulations, and there may be postings that need to occur through that oversight agency.
Thank you, Heather. And then a question from a participant is related to contact tracing and some of the things that you're talking about here. So many of us have heard the term contact tracing and we know that it refers to the ability to follow up with someone that's tested positive. So the question is, what are the training requirements for becoming a contact tracer? Is this something that I can volunteer to help with?
Well, thank you for volunteering. We're always happy to have volunteers. Right now, our contact tracing team is made up by staff here at Linn County Public Health. Most of our staff that are doing the contact tracing do have background in health services. So we have a lot of nurses, we have a lot of LPNs. We are also working with the Cedar Rapids Medical Education Foundation. So we have residents that are completing their training in medical school that are working with us. We have nurse practitioners that are doing this. We also have individuals that are working on their master's program for disease epidemiology. So we do have multiple individuals, but most of them have some type of background already, either in medicine or disease epidemiology, so they can help answer some of those questions that do arise when we're doing contact tracing. Obviously, it's asking a lot of questions about where people have been and what they've been doing. But what we find, especially with a novel virus, so it's a brand new virus, there's a lot of questions, a lot of health-related questions. And so we have found that it really helps to have individuals that do have some background in those health-related fields to help answer those questions. But thank you for your interest. We love having volunteers, so thank you.
Okay. I think we're going to wrap up our questions here because we're getting to the end of our time, but we do have one more that just came in. The question is, has public health inspected and offered advice to the local homeless shelters? Homeless shelters are also businesses. Could we provide a...
Yep. I'm sorry.
Go ahead, Heather.
Again, so this is Heather again. So we have worked with the homeless shelters. So yes, we have provided guidance to them, and we've worked closely with them to make sure that they have the information that they need. If we have someone that we're concerned about in the shelters, we have worked to make sure that they are isolated, and that might be in a different location altogether from the rest of the shelter so that they're not with other individuals that are there. But yes, we agree that they are also a business. We also agree that this is an extremely vulnerable population that we really need to keep an eye on because the disease burden could be extremely large there. So yes, we are working with the homeless shelters. We have great people that are working in those shelters and that we've been in very close contact with. So thank you for that question. That's a great question.
Okay. This is going to be the end of our questions for today. I do want to share some resources that are available for local businesses. And some of these Jasmine mentioned at the beginning of her comments. So right now, if you are watching the visual portion of the town hall, they're on the screen, but I will repeat them. So local resources for businesses include the Gazette Business Resource page, the Cedar Rapids Metro Economic Alliance page. They have a page dedicated to COVID-19. The Marion Economic Development Corporation also has a page dedicated to COVID-19. You can also visit the City of Cedar Rapids Economic Development website or Iowa Economic Development website, and CDC also has some great resources for businesses and employers. We will plan to make this recording and this information shared available after the town hall concludes. For our next week's town hall, we are planning to discuss information regarding personal finance, employment, and legal aid. That's our planned topic for Friday, May 1st. We have been having these town halls at noon, but depending on the availability of the speakers, that time may change. I just want to take a minute before we conclude to again thank our speakers, our panelists, for sharing some of the information that they are able to get out to our community. And thank you for the participants for submitting your questions. Before I end the recording, I just want to give our panelists an opportunity to share anything that we may have missed during our prepared remarks or during the question and answer period. Is there anything, Lacey, that you would like to share before we end the call here?
No, I just want to, wish everybody that they stay safe. And again, if you have any questions, feel free to go to our website or call 1-800-ALLIANT. We're here for you guys and help out in any way we can, and appreciate the opportunity.
Okay. Jasmine, is there anything that you'd like to share before we part today?
No, I would just kind of echo the same sentiment. So if there are questions, we do encourage people to reach out. We're here to offer assistance. So, each business has a unique set of needs, and that's what we're here to do. So if anyone does have resources that they're looking into and need assistance with that, don't hesitate to reach out. We'll get you connected to the right people.
Okay. And then Dustin, any parting words regarding businesses, guidance for businesses today?
Nope, stay safe. Give us a call if you got questions.
Okay. And then Heather, anything that we missed that you might want to share?
Not at this time, but thank you for everyone for participating. I think this is a great way to come together and get questions answered. So thrilled to see so many participants. So thank you.
Okay. Thank you, everyone.